So we're getting there. And then they were talked about a lot of, it's called epigenetic promoter silencing. So it's a type of research that they're doing. So basically, in simplified terms, epigenetics is a study of biological mechanisms that switch genes on and off. So we're trying to get rid of like the bad and just keep the good. And if you can see that, I go more into depth if you want to go into it, but that's the basic sense of what epigenetics is. So that's what their current research is is kind of revolving around that. And then
hopefully we
go.
So we're planning to start collecting blood from patients and healthy controls as well at the clinic, and we can hopefully share some of the blood with a group who's studying epigenetics at the QBI. So we will probably be able to get more into this research as well.
Yeah,
from here, from Brisbane,
because that seemed to be the biggest thing I found that they were focusing on over at the IARC. Yeah. You can probably skip over that. So then we just talked about, they talked about the expansion gene, the triplet expansion gene, the GAA triplet expansion gene, and how epigenetics will work to silence that. So, yeah, I mean, they haven't done it yet. I mean, they're doing it on mouse models at this point, and they've had some success. But I mean, they'll just keep doing trials for that. So there was nothing. It was more just showing that that's probably the latest research that's going on. Then the drug that came out was the 109 RG2833. It's a class 1 HDAC inhibitor. So they're a class of compounds that interfere with the function of histamine deactylase. Is that how I say it? Yeah, deactylase. So it's being developed as a rational therapy for FA, and it'll improve from frataxin, promote frataxin function because obviously it's derived in FA patient cells. And then, so but basically just gone on how they do it. So they're just large proteins. They're commonly referred to as beads. And they're involved in DNA. So their different genes are exposed to transcription and translation.
So Anna, just excuse me, was there any sort of update on the research for that RG2833?
No, they were just saying what it was, that it was ongoing. Yeah.
Okay.
Yeah.
We've talked about that in these meetings for a while now, the HDAC inhibitors.
Yeah.
And that's one that Repligen paid $20 million to get the rights to the scripts. So it's been in development for probably about 4 or 5 years now. And in mice models, it's certainly been able to reverse symptoms. It looks really promising. But when they've done the first human trials, they have had some setbacks with it. So we're all anxiously awaiting for an update.
Somebody now bought it from Repligen?
Yeah, I think Repligen have sold it on to another company who have committed some substantial funds to taking it to the next stage, but they keep having to refine the molecule. There were some nasty side effects occurring which they haven't foreseen. So it's had a bit of a setback, but there's still a lot of optimism that this class of drugs, these HDAC inhibitors, look as though they may be the answer. So there's a lot of effort going into it, but they're fairly secretive about what stage they're at.
They just
very closely guarded commercial property at the moment.
They're using it to treat a lot of like CNS and cardiovascular disorders as well. I think, and then they went on to the phase 3 Actiimmune trial with Horizon Pharma. I think a lot of you have probably heard of that.
So that's one that's referred to as Imicon on the various blogs.
Yeah. So
I'm most excited about it just because the girl in Norway has been...
That's the video, isn't it? I think you sent me. Is that one? Yeah.
Is that the generic interferon?
Yes.
Yes. Yeah.
Right.
Interferon gamma.
Yeah.
Interferon gamma and undulbranemactamine is actually already on PBS in Australia
Yes.
Yes.
for some
Yeah.
epilepsy drug or
Actimine.
That was an osteo thing.
Yeah,
Osteoarthritis or something.
Can we get
But
that?
yeah, it's already on.
but
Yeah,
it's
it's not for
approved for
PBS.
FA.
Yeah, it's not for FA. You can get it for other diseases.
So, if you ask your GP, any reputable GP like mine will say he would not be insured if he gave you Actimine. Because he's not allowed to prescribe it for non-defined disease. So we would all
Like
love
that.
to be on this.
The cost of the
Who knows
drug in
what
Australia
opioid was?
is about 30,000 a year.
Oh.
So 30,000 a year per patient. That's at wholesale prices. So I did speak to the drug company in Sydney, the distributor, and they're willing to supply it. And I spoke to John O'Sullivan about trying to do a trial locally, and he's not prepared to do that at the moment. The main reason being that there are clinical trials already underway elsewhere in the world, in the US primarily. It is a drug that has significant risk attached to it. There are some side effects. And so John's argument is we just need to be a little patient with this drug. It's in a proper trial. We'll get the results soon enough. It would be silly for us to start taking that sort of chance and go to that expense, because if we were to really twist John's arm or another neurologist to run a small trial like that, it ties up a lot of resources, and if something else comes along, and there are breakthroughs happening all the time at the moment, we don't want to have all the resources already locked away duplicating something that's happening in the US.
Yeah, right.
So I think, reluctantly I sort of have to back away from that one. But we're all obviously following Norway with great interest.
It's very well up, and this is the point about there are trials underway. It's pretty well documented as well.
Yeah.
She keeps a really good blog. She's very excited about things that happened to her. Plus, there's stuff going on in Philadelphia, and there's a couple of others, and Italy, I think, or somewhere in Europe. So, yeah, we will get results.
There's a big my dad is a professor in Italy.
Professor Tessie.
Yes, that's it. Yeah, he's
Professor
very
Tessie,
much into
He's going to first identify interferon for FA.
Yeah, I met him. He was very passionate. So they're doing this Actimune trial. So they're just about to do their phase 3. So it'd be a 26-week study with 90 males and non-pregnant female subjects between the ages of 10 and 25. And then they go, so just with their testing criteria, they've just got ability to walk 25 feet with or without assistance, and a functional stage of greater than 1 to less than 5. So I guess we'll just have to wait and see what the results are from that. Yeah, I think they said it will take 18 months to completely enrol the study, and then a 6-month open label extension study will be offered to those FA patients as well, completing the phase 3 study. And then I just looked into it. Horizon Pharma is just a specialty pharmaceutical company, and they have a portfolio of products that include arthritis, inflammation, and orphan diseases like FA. And then I just went into Actimune background. So it's just a biology helmet. Single chain polypeptide containing 140 amino acids. So it's basically a production of Actimune is achieved by formation of genetically engineered E. coli containing DNA which encodes for the human protein. So in simple terms, interferon gamma 1b is made from human proteins, and then these help the body fight viral infections. And then the nicotinamide trial.